Hi, everybody. This is Lee, and I'm talking about some amazing things that are happening in the state of Maryland. That we have contemplation of a single payer bill in Maryland, and then Maryland banned fracking. That was good. And then now we see that Maryland has also created a law against pharmaceutical price gouging in its state. And so I've mentioned before on this channel that states were stepping up because of the lack of leadership at the federal level. That, Donald Trump spoke of negotiating drug prices down to stop drug profiteering. He also spoke of creating a big, beautiful, healthcare system that was affordable and that everyone was a part of it. And so this is not happening. And so the states are stepping up to, create their college for all, their healthcare for all, their, infrastructure programs. They're banning fracking, things that need to be done. Their jobs programs. It's happening at the state level, and this is just such one. In lieu of federal action, advocates across the country are having their breakthroughs in drug pricing. And so Maryland had a victory. In April of 2017, a drug pricing bill passed with overwhelming bipartisan support in the Maryland Senate, and then in the House. The legislation, it's HB 631, took a novel approach to address the rapidly spiking drug prices, and that they were assisted by the recent EpiPen fiasco, the profiteering from that, and that there was strong opposition from the pharmaceutical companies, of course, and that they are very much expert lobbyists in terms of raising the drug prices. But HB 631 became law, and it's a new tool to hold generic drug manufacturers accountable and to stop the price hikes in that state. And so, people didn't know how it was going to turn out. It's uphill battle. They had to counter Big Pharma's tactics, their talking points that they've used over the years. Basically, for 5 decades, they've used the same talking points, that drug prices need to be raised to recoup the cost of research and development, and that legislation to bring the drug prices down would slow innovation and prevent new drugs from being manufactured. This is from the old playbook. It's been used over and over. And that what they leave out is the fact that most drug companies spend more on not manufacturing, but advertising and marketing, or share buybacks or CEO salaries than they do on research. And people know that. But people, feel doubtful when they hear it. It's enough to create doubt and division in a movement. But it happened. The victory in Maryland, it kind of shows, like other states, how it can be done. They need to push back and push back and push back against the false statements, the false narratives, the reimagining of facts about drug manufacturing and pricing. That it's always necessary to push back against false narratives right away, over and over and over. And so this is a victory. Nevada worked on something. The drug prices for people with diabetes. So it's happening state by state by state, and that there's a high-profile case on the ballot in Ohio, the Ohio Drug Price Relief Act. California's tried to get something going, Connecticut, and so people are working on it. Likely they may use Maryland's tactics as a blueprint for how they can accomplish something similar in their state. And so it can be done. We see that Maryland's leading the way. And it usually, once one state does it, the other states can follow behind and really provide some relief for people who are trapped by drug prices in the pharmaceutical industry. Good luck.